Emma, what is the level of nervousness about hospitalizations at this moment?
Hi, thank you so much for having me. There is a level of nervousness in the U.S., and, it's coming into particularly sharp focus in certain parts of the country. We've spoken with doctors in Texas and Arizona who say, they're not sure what the coming days and weeks will bring. And sort of at a broader level, if you look at sort of predictions about hospital capacity, there are expectations that intensive care unit capacity in these states are going to be exceeded in the coming weeks. In particular in Houston, where there's this prediction that, in the county that Houston is in, that there will be, ICU beds will be full in 11 days at the current pace of of spread. So, these are definitely things that are concerning.
So, Emma, I mean, just to draw the link here, because I remember when the COVID-19 crisis started, we had a lot of health professionals talk about it wasn't necessarily the infection rate per se that was leading to deaths, but it was the lack of available hospital treatment rooms and treatment beds to treat those folks. Are there sort of, I guess, alternatives that these hospitals have, given that it's been months since this crisis started, where they can still accommodate people outside of the normal walls of the hospital?
Right. You're bringing up a really important point here, which is that it's not in and of itself concerning that the virus is spreading, right? I mean, we would prefer it to not be spreading, and we'd prefer to stem the infection spread. But ultimately, the concern is that hospital systems will be overrun by extremely ill patients. And so that's the worry here. And right now, we're talking about situations in parts of the country where, ICU beds are filling up. And there are ways hospitals can expand their capacity, right? They can take other hospital beds and put intensive care patients in them. They can get lesser trained, doctors and other medical providers to take care of these critically ill patients. As we've seen in New York City, for instance, you can set up field hospitals outside of, sort of traditional brick and mortar hospitals to house patients. And the concern is not just COVID patients getting care, but patients with all kinds of other conditions getting care too. This threatens our ability to care for both kinds of patients.
Emma, there are now real lessons being learned from what happened in New York in particular. Some of the failings because of the pandemic and the panic that swept, the fact that not enough perhaps movement was happened in a concerted manner between public hospital and private hospital, where there is a little bit more capacity, perhaps also some of the ways in which uses of ventilators the ventilators weren't really working properly, or they were too old. This is all being reported across the board. But are there learnings from other states that have already been hit hard, and are they being adopted by the likes of Texas, Florida, California, that now see themselves in the eye of the storm?
Yeah, you're raising a really important point here, which is the sense of preparation right at the beginning of the pandemic. We knew so little about this condition, and we didn't know what kinds of equipment we would need. That ended up being some very high-profile crunches for things like ventilators. There's a lot we've learned about the virus, not just treating it, but also how to coordinate care. So in Arizona, for instance, the governor has talked a lot about this surge line that they use to coordinate capacity between hospitals. And so in recent weeks, he's emphasized, IC beds may be filling up. They're at over about 80% full, at recent check. But, we have the ability to coordinate between hospitals. If one hospital is full, we can send patients somewhere else, and we can do this really well. So there are things we've learned, but, preparing for something like this is not as straightforward as it sounds, because there are just ways in which, as one doctor I talked to in New York said, you don't really know how to prepare until you're in it in some ways, even though we still know so much more now than we did before. And that's the concern, right? Hospitals say they're more prepared than they were, but, when it's crunch time, we'll have to see what happens. And that's a frightening prospect.